Right now, I'm not that worried about COVID on campus. Over 90% of our students and staff are vaccinated, and cases are decreasing every week.
I think it's a really real problem that a lot of people don't really care about anymore.
I'm younger, I'm fully vaccinated. I don't carry a risk personally if I catch COVID, but I know that it's up to me getting vaccinated and stuff so that I limit how I spread to other people, especially those at risk.
Nah.
I don't care about Corona at all.
It's easy to see that there are plenty of differing opinions about controlling COVID in college communities.
I looked at 10 different universities across the nation. I wanted to find out how COVID safety measures impacted the number of COVID-19 cases since the start of the fall 2021 semester. I looked at schools with and without mask and vaccine mandates. Here's what I found. 8 of the 10 universities require masks in all indoor campus facilities. The only 2 who don't, the University of Georgia and Georgia Tech. 4 of the 10 universities require vaccines. These schools include Michigan, UCLA, University of Chicago, and Harvard. Those schools have accountability measures in place, including fines for unvaccinated students. Unvaccinated faculty and staff face disciplinary action up to possible dismissal. The other 6 universities strongly urge vaccination, but there's no requirement. Instead, these schools, UGA, Georgia Tech, Clemson, Alabama, Auburn, and Florida, are offering incentives to get vaccinated. There are lots of factors that impact COVID cases. That's apparent when you look at these 10 universities, their various COVID management practices, and the number of cases since the fall semester started. Here are the COVID numbers for these 10 universities. UCLA, Chicago, and Harvard started their semesters a month later than the other schools I checked, but even if you remove them, the bottom line is this. These universities, the University of Georgia and Georgia Tech, without mask and vaccination mandates, have a similar number of cases as the ones that do have these mandates. Former CDC Chief of Media Relations, Dr. Glenn Nowak, says that this makes assessment for effectiveness a challenge.
Well, if the numbers are similar, it would suggest that maybe they're not, right? It's really hard to assess the real world effectiveness of masks because it's contingent upon a lot of things. It's contingent upon how much COVID-19 or how much of the coronavirus is present at a given moment. The question, it becomes, I think, not just a scientific issue, it becomes a value judgment. It's better for me to not have to wear a mask around my face when I'm in social setting. So I value the benefits of that more than I'm worried about the risks.
Dr. Nowak says that there's a trade-off between the benefits and risks of wearing a mask. He feels differently about vaccines.
Vaccines are mandated by universities, including the University of Georgia. We do have vaccine mandates. We mandate that students have meningitis vaccinations. That's not a new or novel idea. The idea that a mandate is unique or different because it's COVID, there really shouldn't be that kind of concern. Universities do have the right and the ability to mandate vaccines. And it makes a lot of sense. And now that there's a licensed vaccine, I think it makes a lot more sense for universities to look at whether they should make that a requirement as a way to prevent the spread of COVID on their campuses.
According to Dr. Nowak, vaccines are effective at minimizing the effects of respiratory illnesses such as COVID-19, but they only prevent people from becoming very sick, not becoming sick in the first place. He believes that vaccination will help to decrease severe disease across college campuses, and that masks may not have as strong as an effect since the benefit of people ages 18 to 24 wearing them is not as great as the cost.
From my investigation of 10 different universities, I observed no change in the number of COVID cases between schools with and without mask and vaccine mandates.
So it becomes really hard, I think, to come up with a blanket statement about the effectiveness and the value of mask mandates or wearing masks long term.
Nowak says that the virus is not going away, but he does believe that the urgency of mandates will decrease by age group.
This virus is not going away.
Yeah.
This virus is going to be with us probably for perhaps the rest of our lives in some way, shape, or form. I think for some people, the question is what is your criteria for telling people that they no longer have to wear a mask in a public setting? That's how I think it'll unfold by age group. It won't be that we all at one point do something. I think we're going to see wow, there's a lot of people who are 40 and under doing relatively little other than getting vaccinated, and there's a lot of people 65 and older who are, acting as if we're still in a major pandemic. And I don't think we should be. I think that's how it's going to play out.
Ashley Galante, Grady Newsource.